Clean, healthy mouth is fundamental to everybody's quality of life. Think how horrible you feel if you've been travelling overnight, spent an unplanned night in hospital without a toothbrush, or just waking up the morning after the night before. For older people, oral diseases are not only painful and distressing, they have an impact on a person's ability to eat and speak, and are also linked to a number of other health problems, some of which are serious and can be life-threatening. For those of you working in care homes, the people you care for are at higher risk of oral health problems because of their dependency, which can be increased if they have dementia. As we go through this presentation, notice the person's smile or mouth on each image. This is often one of the first things we notice about someone, and the people you are caring for are no different. Mouth care, or oral care, is an essential element of care that you will need to carry out. If you think about the 5 underpinning principles from Scotland's health and social care standards, which are dignity and respect, compassion, being included, responsive care and support, and well-being, you can see how giving good mouth care fits into these and how these principles need to underpin how we give this very personal element of care. There are 4 learning outcomes for today's session. Good oral care contributes positively to someone's overall health and well-being and is a key factor in someone's quality of life. Eating, drinking and swallowing problems are not uncommon among older people and require thorough assessment. Toothbrushing, diet and dental visits are essential but may need some adaptations for older people. Mouth care is even more important for those who are taking nutritional supplements such as build-up drinks or smoothies, and even medicines that are delivered in syrupy solutions, because these often contain a lot of sugar. People who are not able to eat anything and are being fed by a peg tube still need really good oral care. Dental decay and gum disease are entirely preventable with effective daily mouth care. Looking after someone's oral soft tissues, so that someone's lips, tongues, gums, hard and soft palate, are just as important as looking after their teeth. We will also look at when a person with dementia won't let you near their mouth. For someone who's resisting mouth care, ask yourself, are they frightened? Are they feeling threatened? Are they in pain? What else is going on? Oral care is the responsibility of every member of staff. Risk assessments, care plans and documentation of daily care should be carried out for all clients. We will include a brief consideration of capacity and consent issues, and at the end of the presentation we will touch on mouth cancer, which is important not just for the people you're caring for, but also for you. So why is oral health care important? Poor oral health affects overall health, nutrition, quality of life, communication and appearance. Many older people are now retaining their own teeth, which can make caring for their mouth even more challenging for staff. Inadequate oral care can have a detrimental impact on someone's nutrition and hydration levels. This links to their quality of life and is important for an individual's health resilience. It impacts on healing times, as well as someone's susceptibility to infections and other illnesses. People with diabetes are more prone to gum disease, as reduced blood flow delays the healing process. Infections from the mouth can affect general health and vice versa. Oral bacteria from a dental abscess can cause septicemia or blood poisoning. Oral bacteria can cause specific heart damage, endocarditis, in people who have pre-existing heart valve problems. And poor oral hygiene is a key risk factor for pneumonia in vulnerable individuals. Some of you may find this aspect of care difficult. Perhaps you even find it distasteful. You may feel confused over consent issues or be anxious about putting your fingers in someone's mouth. You may feel frustrated when you feel that people are being uncooperative, and will consider this a bit later on. It can be time-consuming and largely invisible, so you may feel pressures around time. A painful mouth can be upsetting, and for people with dementia may cause increased confusion and challenging behaviours because they're not able to convey that they're in pain. A painful mouth prevents people from eating and drinking, and so could contribute to undernutrition and dehydration. Enjoyment of food, as we all know, is important to quality of life. This is what your job is all about. Poor oral health can affect someone's quality of life, lower self-confidence, and alter self-image, as well as their ability to speak. One of the first things to consider is whether the person has their own teeth. In some ways, it can be more challenging to ensure that someone with their own teeth has good care than those with dentures, particularly if they have dementia and resist care. Increasing numbers of older people will have their own teeth. Think about some of the other areas that you'll need to consider. Do they have any pain or discomfort? What medication are they on? Do these have side effects such as a dry mouth? Do they have a dry mouth? Are they able to manage making or taking drinks themselves? Are they a smoker? Have they been seen by a dentist? How much are they able to do for themselves? Going back to the principles of care that I mentioned at the beginning, promoting independence is vital as it contributes to an individual's sense of dignity and self-respect. This is a photo of a healthy mouth. You can see that the teeth are clean, the tooth surface is covered in enamel and free of decay. The gums are pink and the soft tissues are pink and moist. This is a healthy tongue. It's pink and symmetrical with a slightly rough surface. The roughened upper surface is covered with tiny papillae. Like any surface in the mouth, the tongue should be kept clean and moist. This is a photo of the roof of the mouth. Again, it's pale pink, moist and firm to touch. If you see any red patches, these are generally a sign of inflammation or infection. Finally, this is the floor of someone's mouth. Notice the blood vessels and that the mouth is nice and moist. The saliva is acting as a lubricant and contains important enzymes that help break down food. For the general population, brush teeth and gums thoroughly twice a day with a fluoride toothpaste. Spit, don't rinse is advised to allow fluoride to act. For older people, the spit, don't rinse message may not be applicable, especially those with a dry mouth. Some people, especially those with dementia, may be unable to spit and should use a non-foaming toothpaste. Keep sugary snacks and drinks to mealtimes where possible. Many people receiving care from you are at risk from dehydration and undernutrition and may require sugary food and drinks. Be seen by the dentist regularly for dental examinations. Even if someone has no natural teeth, they should still visit the dentist at least every 2 years. Older people should still see a dentist regularly. Access to a dentist will vary between care homes, but every area should have a local protocol for referring to a dentist. This photo shows someone with a severe buildup of dental plaque. Plaque causes or contributes to dental decay and is the major cause of gum disease. It's present in all mouths. It's a sticky film of bacteria that forms minutes after brushing and can form on all surfaces of the teeth, dentures, crowns and bridges. If it's left in the mouth, it can harden and become tartar. It's removed by thorough toothbrushing at least twice daily. It's the destruction of the enamel and dentine of the tooth. When the enamel is weakened, it can break off and form a hole. When the decay reaches the dentine, it causes pain and infection. The basic process is demineralization and is sometimes called an acid attack. This happens when sugars from food and drinks are mixed with the plaque bacteria forming acid. The acid attack will last for 1 to 2 hours. If more sugar-containing foods or drinks are taken within this time, the acid attack will last longer. The more acid attacks that take place, the higher the risk of tooth decay. This slide shows someone with gum disease, and you can see that the gums around the teeth have become red and swollen. As I've just been saying, gum disease is caused by plaque and poor oral hygiene. Smoking can also make it worse as it causes a lack of oxygen in the bloodstream, which makes healing more difficult. When you brush your teeth, even if your gums bleed slightly, continue to brush them. The bleeding is usually the result of plaque building up, and continued brushing will help improve your gum health. There are two types of gum disease. Firstly, early stage, gingivitis, and secondly, advanced stage, periodontitis. At this stage, gum disease can be reversed. Often people will suffer from bad breath, and the first sign can be blood on the toothbrush or after spitting out. At this stage, the gum and bones supporting the teeth have been destroyed by the plaque underneath the gum, making the teeth loose. This is irreversible, and teeth can fall out, which can affect eating and can be inhaled, leading to a possible medical emergency. This can be prevented by regular and methodical removal of plaque by thorough brushing twice a day. Remember to promote self-care as much as possible. Again, this links back to the principle that people are given the dignity to perform care for themselves rather than having other people do things to or for them. We'll think first about someone who has their own teeth. As I said, if the resident or client is able to brush their own teeth, then they should be encouraged to do so morning and night and assisted if necessary. Some conditions such as a stroke, arthritis, Parkinson's disease, dementia can make it harder for people to brush properly, and this is where you may need to help. You should use fluoride toothpaste twice daily because this increases the teeth's defense against decay. Non-foaming toothpastes are available for people with swallowing difficulties from chemists. A soft to medium small-headed toothbrush is suitable for most people. It should be replaced every 3 months or sooner if bristles become deformed or splayed, as this decreases the effectiveness in removing plaque. Very soft toothbrushes are kinder to the soft tissues of a resident with a dry mouth or ulceration, or who is receiving palliative care. When explaining what you're doing, remember to take into account factors such as an individual's personal preferences and whether they have dementia. Always explain to the person what you're about to do. Find a position which is comfortable for them and ensure that their head is supported, for example, in the crook of your arm. You may need to try different positions to suit the person, making sure that their head is supported. Use a pea-sized amount of toothpaste on the toothbrush. Start on the upper or lower teeth. Work round the outside first, gently brushing each tooth for a count of 6. When you finish the outside, work your way back on the inside, methodically cleaning each tooth. Then clean the chewing areas. Start again on the other jaw, repeating what you've just done. As I said, even if the gums bleed slightly, continue to brush them. The bleeding is usually the result of plaque buildup, and only continued brushing will improve gum health. Allow the resident or client to spit out and prompt them if required. Just like natural teeth, dentures need to be kept clean because plaque can build up on dentures, and if not cleaned regularly can cause denture-related infections such as thrush. Other equipment, like denture boxes, also need to be kept clean. Again, encourage someone to do as much as they can for themselves. Clients may wear a full denture or partial denture, which is often called a plate. It can sometimes be difficult to tell what are dentures and what are natural teeth, so a thorough assessment should be carried out. All dentures should be marked clearly with someone's name or other form of identity. Ideally, dentures should be rinsed after every meal. Clean dentures morning and night using a toothbrush and denture cream or unperfumed soap and water. Clean the roof of the mouth, gum ridges, and tongue with a soft toothbrush. You should daily disinfect plastic dentures in a solution of sodium hypochlorite, which is what you would use for a baby's feeding bottle. Once a day, usually after night cleaning, soak plastic dentures in the disinfecting fluid for 20 minutes and then overnight in plain water. Dentures with metal parts should be soaked in chlorhexidine 0.2% solution, which is widely available from pharmacists. Even if someone is reluctant to remove the dentures, You should try and take them out, clean and soak them for 20 minutes each day in disinfecting solution. Ideally, dentures should be removed overnight to allow the gums and soft tissues to rest and to help prevent fungal problems. Popular brands of effervescent denture cleaners do not effectively remove plaque, bacteria, heavy staining or tartar, and importantly, they do not eliminate denture-related infections. Check first to see if someone is able to remove their own dentures. If they can't, remove the lower set first, then remove the upper one. Break the seal by rocking the denture gently from side to side until it's dislodged, and then remove the denture at an angle. If someone has a partial denture, carefully place your fingers under the clasps that are hooked onto the teeth and gently push downwards. Take hold of the plastic part and pull carefully out of the resident's mouth. Avoid bending the wire. Brush the dentures with a toothbrush and denture cream and rinse thoroughly with water. For partial dentures, carefully brush the metal clasps to avoid distorting them. Remember to brush natural teeth while the partial dentures are removed. Dentures should be rinsed under clean water before being replaced in the resident or the client's mouth. Again, if the client is able to do this themselves, then encourage independence. If not, replace the upper denture first and replace each set by gently inserting the denture at an angle, then rotating them into position. You will need to put on gloves and a penny and have some wet gauze swabs, woven ones, wrapped around your gloved fingers. The gauze should be changed when required and several pieces of gauze used to clean the mouth. If someone has a tendency to pocket their food, you should make sure the mouth is fully cleared. The mouth should be cleaned or at least rinsed with water after meals and after taking medication. When a person has a dry mouth, the tongue surface can become sore and cracked and requires particular care, which we will discuss later. Dry, cracked lips are uncomfortable for any individual, and many of us will regularly use a lip balm stick to keep our lips feeling moist. Lips should be cleaned with water-moistened, non-fraying gauze and protected with a lubricant, for example, water-based saliva replacement gel or aqueous cream. Don't use petroleum lip balm such as Vaseline, which can actually increase the dryness. It's important you document in someone's care plan what you've done, along with the best way of delivering that care. You should regularly note the condition of someone's mouth and any changes escalated to the person in charge. It's also important to document any reasons that someone has refused mouth care so that this can be addressed. Part of someone's initial assessment should include consideration of whether someone has capacity. Remember that an adult does not necessarily have impaired capacity simply because they have dementia, particularly in the early stages. Remember that a person can be assessed as having capacity to consent to some decisions and not others. If the resident is assessed to lack capacity to consent to medical treatments and care, the assessor will provide an Adults with Incapacity Part 5 certificate, which is called a Section 47, and this should be in the service user's file. If the resident or client has some capacity to make some decisions, the certificate's treatment plan will clarify what the person is capable of and what decisions need to be made for them. This is a common side effect of many medications, and if any of you have been on one of the older antidepressants, you will know just how unpleasant it can be. It can also be a sign of dehydration, and it makes speaking, chewing, and swallowing difficult and can lead to unplanned weight loss, as well as making someone feel miserable. Saliva protects and lubricates teeth and gums. A lack of saliva can cause a dry mouth and often goes undetected, particularly in people with dementia. A dry mouth increases the risk of decay for people who have their own natural teeth and makes wearing dentures much more difficult. Encourage regular sips of water. Saliva substitutes, for example, water-based saliva replacement gels and sprays such as biotin, are widely available from chemists. They are very effective and can be used as often as required. Gel can be smeared on the surface of the dentures closest to the gum. When someone is reaching the end of a life, it's really important that final goodbyes are not tainted by memories of foul-smelling breath, a dry mouth, or cracked lips. Regular mouth care is an absolutely vital part of care. A dry mouth, ulcers, or thrush should be treated appropriately at all times, not just for someone who is at end-of-life care. We will now consider some ways that you might try when someone resists our oral care. As always, do all you can to encourage as much independence as possible. Individuals may be more cooperative when you encourage them to carry out their own care. Think about the basics, about your attitude and body language. And if your attempts fail, don't just give up. Some of these simple techniques and strategies may help you. When is the best time of day? Develop a routine with oral care. Carrying this out at the same time every day may help. People with dementia can have patterns, so consider asking family members or previous carers for advice. Sometimes it can be helpful to have more than one person helping, although the person may also respond better to a single well-known member of staff. Think about the location. Is it comfortable and familiar to the individual? Carry out the task in a quiet, distraction-free environment with sufficient lighting and where the person feels comfortable. Be caring, calm, and friendly, and smile. Talk clearly and go at the individual's pace. Explain in short sentences and in simple terms what you're doing. Use closed questions that require a yes or no answer. Use reassuring and appropriate body contact and gentle touch. Be aware of the residents' needs, of their need for personal space. Ensure that they're relaxed and be willing to slow down or to try later. Try simplifying the task and breaking it down into small steps, but don't expect the person to remember more than one step at a time. Bridging helps to engage the individual with the task through their senses and helps them to understand. Describe and show the toothbrush. Mimic brushing your own teeth. Give them a spare toothbrush, and they may mirror your behavior and brush their own teeth. Chaining involves gently bringing the person's hand to their mouth while describing the activity, and then letting them continue if they're able. If chaining is not successful, then place your hand over the person's and gently brush their teeth together. If none of these strategies work, then try distracting the person by placing a familiar item in their hand while you brush their teeth. Rescuing is a common tactic used with other tasks. If attempts are not going well, you can leave, and the rescuer or a second person comes in to take over. This person brings a fresh approach and may encourage the person to cooperate. Oral cancer can affect the lips, mouth, or throat. It's twice as common among men than women, and approximately 85% of new cases occur in people aged over 50 years. You should look for any red, white, or speckled patches. Look for lumps or bumps in the mouth or on the lip. Look for ulcers or sores. Even if they are painless that do not heal within 2 weeks, these must be investigated by a dentist urgently. People who smoke and drink alcohol heavily are at higher risk. Also, building workers, gardeners, and farmers who have excessive exposure to the sun. The key message is, if in doubt, get checked out. So, in conclusion, remember, promote independence. Twice daily toothbrushing as a minimum with a fluoride toothpaste. Keep lips supple and moist. Clean dentures. Ensure frequent oral fluid intake. Document mouth care delivery. Evaluate the effectiveness of care delivery and escalate any concerns. As we said at the beginning, mouth care is an essential element of care that you'll need to carry out. As you undertake this care, think about the 5 underpinning principles of care. dignity and respect, compassion, being included, responsive care and support and well-being. I hope you can see how giving good mouth care, which is such a very personal element of care, needs to be underpinned by these standards. This session has been prepared and delivered by Alison Jarvis on behalf of the NHS Lothian Clinical Education team.